Hi everyone, welcome to Concept in Medicine. In today's tutorial, we are going to be looking at the anion gap. And the question goes, what is the anion gap? You should know that the anion gap is the difference between the serum principally measured cations and anions. The cations, we are talking about sodium ions and potassium ions. For the anions, we are talking about the chloride ions and the bicarbonate ions. Now let's move ahead and look at how to calculate the anion gap. So with the calculation of the anion gap, it is dependent on which cations are being used to calculate the anion gap. So let's look at the first one. With the first one, the anion gap, we are using both sodium and potassium ions. So in this case, the sum of the concentrations of sodium and potassium ions, that sum, then you also sum the concentration of the principally measured anions, that's the chloride ions and the bicarbonate ions. Then you find the difference where it is going to be the cations minus the anions. If potassium ion concentration is included in the formula, then in that case, the normal anion gap is equal to 16 plus or minus 4 millimoles per liter or milli equivalent per liter. And if you do that calculation, it will give you 12 to 20 millimoles per liter or 12 to 20 milli equivalent per liter. Then the next formula will be that which is without the potassium ions. So for that, we are going to have anion gap being equal to the sodium ion concentration. In this case, we are only using sodium minus the sum of the concentration of the principally measured anion, which will be the chloride ions and the bicarbonate ions. And for that, the normal anion gap when excluding potassium ions would be equal to 12 plus or minus 4 millimoles per liter. So that will give us 8 to 16 milli equivalent per liter. Now let's move ahead and look at when do we say the anion gap is increased, when do we say it is normal, and when do we say it is decreased. We will say that the anion gap is elevated when the anion gap is greater than 12 milli equivalent or millimoles per liter. If the anion gap is greater than 12 millimoles per liter, then we'll say that it is elevated. Then the question goes, what are the causes of an elevated anion gap? To simply and easily remember that, we'll say that you should always think of the MAD pilus. The MAD pilus. So for the MAD pilus, it's an acronym that would help you to get the various causes of an elevated anion gap. So the M stands for methanol. The U, we are talking about uremia. The D, diabetic ketoacidosis, where you have the production of ketone bodies, including the acetone, the beta hydroxybutyrate, and the acetoacetate. And the acetoacetate is what is responsible for the acidic nature. It is what gives the acidity. That will go for the diabetic ketoacidosis. The P is the propylene glycol. The I, isoniazid intoxication or ion overload or infections. The L, we are thinking of lactic acidosis. The E, thinking of ethanol or ethylene glycol. The R, we are thinking of rhabdomyolysis or renal failure. And the S, salicylate poisoning. That would do for the causes of an elevated anion gap. Let's move ahead and look at those causes that would give us a normal anion gap. When do we say that there's a normal anion gap? We say that there's a normal anion gap when the anion gap ranges from 6 to 12 millimoles per liter or 6 to 12 milli equivalent per liter. And what are the causes of a normal anion gap. So for the normal anion gap, we are thinking of diarrhea where there will be loss of bicarbonate. We can also think of a patient recovering from diabetic ketoacidosis. We can also think of renal tubular acidosis. Then we can also think of a scenario where patient is receiving parenteral administration of what? Amino acid, that is the selamine, which in case is containing lysine and arginine as amino acid, can also give rise to a normal anion gap. Then the next one is the carbonic anhydrase antagonist. Examples we can think of topiramide and acetazolamide. Then finally, we can also think of fluid loss from ileostomy. Fluid loss from ileostomy. Now, finally, let's move ahead and look at the causes of a decreased anion gap. When do we say the anion gap is decreased? We say that the anion gap is decreased when the anion gap is less than 6 millimole per liter or 6 milli equivalent per liter. And what are some of the causes of a lowered or decreased anion gap? We can think of multiple myeloma, which is considered as the chief plasma cell dyscrasia, which leads to the overproduction of serum paraproteins in the form of immunoglobulin G. Then we can also think of hypoalbuminemia, and finally bromide intoxication. So these are the various causes of the various ranges of anion gap. If it is raised or elevated, always think of the MAD pilus. Then for the normal, we mentioned the causes, and also for the decrease, where we said the chief plasma cell dyscrasia, that's multiple myeloma, is also a cause of a decreased anion gap. I believe that we have gotten a lot of understanding from this tutorial session. Thank you very much for joining me in this tutorial session. Kindly make sure to subscribe, like, share, and also comment the next concept you would like to see on my channel. My name is Dr. Del, and this is Concept in Medicine. Bye bye.